again. And this one is, why am I growing a flap of gum at the back of my molars? And how do I get rid of it?
So one of the most common things that we see why you have a flap of gums around your back molars is sometimes the wisdom teeth are starting to come through, or sometimes people may be thinking that they have a flap of gum around their regular molar. It may not be a regular molar, it could be a third molar, which is the wisdom tooth. So when the wisdom teeth are starting to come through, and we talked about the growth pattern, sometimes you may not have room for the teeth to come through. For example, when your teeth are already crowded, now when your wisdom teeth are starting to come through, so then they don't have enough room. So they need to be removed. So when they need to be removed, and if you don't remove them at the proper time and at the proper age, so then you have this big flap of gum tissue sitting on the top, which is not normal. So people are thinking, well, if it is just a flap of gum, I'm just going to probably brush and keep it clean, and I may not take any action for it. But the real challenge becomes when it becomes inflamed, when you may not see all the yucky food that sometimes gets under, and the bacteria gets under, the bad bugs get under. And I commonly see patients with a big abscess or a big pus pocket that develops because of the big flap sitting in there. And then a lot of times I saw a kid today. He's only like about 19 years old. He had this big flap of gum tissue here. But what he did not realize is this is his tooth, the last second molar, and the third molar is kind of sitting right here in the back. It's not able to come through properly like that. So now because it is sitting in the back, so the food is getting wedged in between the second molar and the third molar. Now he has a big cavity on the second molar. So the challenge is now if he's going to not remove that third molar, the wisdom tooth, now the cavity on this tooth is going to get bigger and he's going to end up losing that tooth. So what we talked to him about was removing all four third molars, all four wisdom teeth. So now he's going to come tomorrow to get those wisdom teeth removed. So now hopefully by removing those, now there is no more flap of gum tissue on the back. And now there is no more food packing, no more pus pocket. And then the biggest advantage of removing it now is once you remove it, because there is no more food packing, now he's going to be able to keep that second molar. And the small cavity that started here, hopefully because of the minerals that we talked about, the calcium and the other minerals, and hopefully by doing that, and if he's able to keep it clean, and he may not ever need any treatment for that back tooth. However, if we don't remove the tooth, and you know what happens, and the cavity is going to get bigger. Now he's not only going to end up having to remove the third molar, but also he's going to end up losing the tooth in the front unnecessarily. So the bottom line is, if you have a flap of gum tissue, most likely it could be related to your third molar or your wisdom tooth. So next time when you're to your dentist, ask him whether it is related to the third molar or your wisdom tooth, and they will be happy to answer that question for you. And if your dentist is able to remove the wisdom tooth, they will be able to take care of that, or they may be sending you to one of our specialist offices like us, a periodontist or an oral surgeon, to take